When Sarah Martinez hired private investigator David Chen to follow her mother-in-law around Chicago for 2 weeks, she expected to find evidence of shopping addiction or secret gambling debts. Instead, the photographs revealed a conspiracy so profound that it would expose a multi-million-dollar healthcare fraud, save dozens of elderly lives, and transform Sarah from a struggling physical therapist into the whistleblower who brought down one of the most respected medical institutions in Illinois. But before Sarah became the unlikely hero who challenged a corrupt system, she was just trying to save her marriage and understand why her mother-in-law seemed determined to destroy her family from within. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. Sarah Martinez had always believed that hard work and dedication would eventually lead to success and happiness. At 32 years old, she had built a modest but fulfilling career as a physical therapist, specializing in geriatric care at Riverside Community Health Center on the south side of Chicago. Her patients appreciated her patience, her gentle approach to rehabilitation, and her genuine concern for their overall well-being beyond their immediate physical therapy needs. The small clinic where Sarah worked served primarily elderly residents from working-class neighborhoods who relied on Medicare and Medicaid for their healthcare coverage. These were individuals who had spent their lives in factories, service jobs, and other physically demanding occupations, often developing chronic conditions and mobility issues that required ongoing therapeutic intervention to maintain their independence and quality of life. Sarah found deep meaning in her work because she understood firsthand the challenges that her patients faced. Her own grandmother had struggled with arthritis and diabetes in her final years, and Sarah had witnessed how proper physical therapy could mean the difference between living independently and requiring expensive assisted living care. This personal connection to her profession drove her to provide the highest quality care possible, often staying beyond her scheduled hours to ensure that patients received the attention they needed. The financial realities of working in community healthcare meant that Sarah's income was modest despite her education and expertise. Physical therapists in private practice or high-end rehabilitation facilities commanded significantly higher salaries. But Sarah had deliberately chosen to work in underserved communities, where her skills could provide the greatest benefit to people who might otherwise lack access to quality care. Her husband, Michael Rodriguez, worked as a high school mathematics teacher at Roosevelt High School, in the same neighborhood where Sarah's clinic operated. Their combined incomes provided a comfortable but careful lifestyle in a 2-bedroom apartment in Pilsen, where they had lived for the 3 years since their marriage. Both shared a commitment to serving their community and building careers that contributed positively to society, even if those careers did not generate the financial rewards that other professional paths might have offered. The couple had met during Sarah's final year of physical therapy school, when Michael was completing his master's degree in education at the University of Illinois at Chicago. Their relationship had developed gradually through shared study sessions at the campus library, conversations about their professional aspirations, and a mutual recognition that they both valued service to others over personal financial advancement. Their marriage had been a modest celebration attended by family and close friends, reflecting their practical approach to life and their commitment to building a partnership based on shared values rather than expensive displays. They had postponed plans for children while focusing on establishing their careers and saving money for a house down payment, understanding that their current financial situation required careful planning for major life changes. Sarah's daily routine began each morning at 6:30 with a 40-minute commute on the Chicago Transit Authority from their apartment to the clinic. She used this travel time to review patient files, plan treatment sessions, and prepare for the challenges that each day would bring. The commute also provided quiet time for reflection and mental preparation, helping her maintain the positive attitude and emotional resilience that her demanding work required. Her caseload typically included 12 to 15 patients per day, ranging from recent stroke survivors learning to regain mobility to elderly individuals managing chronic conditions like arthritis, osteoporosis, and the lingering effects of injuries sustained years or decades earlier. Each patient required individualized treatment plans, careful documentation for insurance purposes, and ongoing assessment to ensure that therapeutic interventions were producing meaningful improvements in function and quality of life. The most rewarding aspect of Sarah's work was witnessing the progress that dedicated patients could achieve through consistent effort and proper guidance. She had helped stroke survivors regain the ability to walk independently, assisted arthritis patients in developing pain management strategies that reduced their reliance on medication, and worked with accident victims to restore mobility that medical professionals had initially thought might be permanently lost. However, the healthcare system in which Sarah operated presented constant challenges that often frustrated her commitment to providing optimal patient care. Insurance restrictions limited the number of therapy sessions that patients could receive, forcing Sarah to achieve maximum results within artificially constrained timeframes. Documentation requirements consumed increasing portions of her workday, reducing the time available for direct patient care, while creating administrative burdens that added stress to her already demanding schedule. The clinic where Sarah worked was owned by Meridian Healthcare Network, a regional healthcare corporation that managed 17 facilities throughout the Chicago metropolitan area. Meridian promoted itself as a community-focused organization committed to providing accessible healthcare services to underserved populations, and its marketing materials emphasized the company's charitable mission and commitment to social responsibility. Sarah had initially been attracted to working for Meridian because of this stated commitment to community service and the company's reputation for supporting employee professional development. However, her 3 years of employment had revealed growing tensions between the company's public mission and its operational practices, particularly regarding patient care standards and resource allocation decisions. Corporate directives from Meridian's central administration increasingly emphasized productivity metrics, patient throughput, and cost control measures that Sarah felt compromised her ability to provide the quality of care that her patients deserved. Pressure to reduce treatment session duration, limit follow-up appointments, and minimize the use of specialized equipment created an environment where achieving corporate financial targets often conflicted with achieving optimal patient outcomes. Sarah had raised these concerns through appropriate channels within the organization, participating in staff meetings, and submitting formal feedback about policies that seemed to prioritize efficiency over effectiveness. Her supervisors consistently responded that corporate policies were developed by healthcare management professionals who understood the broader financial and regulatory environment better than individual clinicians, and that adherence to established protocols was essential for maintaining the company's ability to serve the community. These institutional tensions had created a source of ongoing stress in Sarah's professional life, as she struggled to balance her commitment to patient advocacy with the practical necessity of maintaining her employment. She had considered seeking positions with other healthcare organizations, but similar corporate pressures affected most facilities in the region, and smaller independent practices rarely offered the job security and benefits that she and Michael needed to maintain their financial stability. The impact of these workplace challenges extended into Sarah's personal life, as she frequently returned home exhausted and frustrated by her inability to provide the level of care that she knew her patients needed. Michael provided emotional support and encouragement, but he faced similar pressures in the educational system, where standardized testing requirements and budget constraints limited his ability to address individual student needs effectively. Their conversations often revolved around their shared desire to make meaningful contributions to their community, while navigating institutional systems that seemed increasingly focused on metrics and cost control rather than human outcomes. Both understood that their work remained important despite systemic limitations, but the constant tension between their professional ideals and operational realities created ongoing stress in their relationship. The couple had developed coping strategies that included regular weekend activities outside the city, where they could disconnect from work pressures and reconnect with each other and their personal relationship. They enjoyed hiking in nearby state parks, visiting museums and cultural events in downtown Chicago, and maintaining friendships with other couples who shared their values and interests. However, their financial situation limited their ability to pursue more expensive recreational activities or travel opportunities that might have provided greater respite from work-related stress. Their careful budgeting allowed for modest entertainment and dining expenses, but major purchases or experiences required months of planning and saving to accommodate within their income constraints. Sarah's relationship with her extended family provided additional support and stability in her life. Her parents had immigrated to Chicago from Mexico when Sarah was young, and they had instilled in her strong values regarding education, hard work, and service to others. Her father worked in construction while her mother cleaned offices at night, and both had made significant sacrifices to ensure that Sarah could attend university and pursue professional education. The cultural values that Sarah had inherited from her family emphasized respect for elders, commitment to community welfare, and the importance of maintaining family relationships even during difficult times. These values aligned closely with her professional commitment to geriatric care and her personal dedication to serving vulnerable populations who might otherwise lack access to quality healthcare services. Sarah's parents lived in a modest house in Little Village, approximately 30 minutes from Sarah and Michael's apartment, and the couples maintained regular contact through weekly family dinners and participation in community events at their local parish. These family connections provided emotional grounding and cultural continuity that helped Sarah maintain perspective during challenging periods in her professional and personal life. The introduction of Michael's mother, Elena Rodriguez, into their family dynamic had created complications that Sarah was still learning to navigate after 3 years of marriage. Elena was a 68-year-old widow who had moved to Chicago from Phoenix 2 years earlier to be closer to her son and daughter-in-law, ostensibly to provide family support and participate more actively in their lives as they planned for their future together. Elena's arrival had initially seemed like a positive development as she appeared eager to help with household tasks, cooking, and other domestic responsibilities that might ease the pressures on Sarah and Michael as they managed their demanding professional schedules. Elena possessed considerable experience in healthcare administration from her previous career in Phoenix, and she frequently offered advice about navigating insurance systems and healthcare bureaucracy that she believed would benefit Sarah's professional development. However, as Elena became more integrated into their daily lives, Sarah began to notice patterns of behavior that seemed designed to create tension rather than provide support. Elena frequently criticized Sarah's housekeeping standards, cooking methods, and time management practices, often making these observations in front of Michael in ways that seemed calculated to create conflict between the spouses. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story. More troubling were Elena's increasingly frequent comments about Sarah's career choices and financial contributions to the household. Elena regularly suggested that Sarah should pursue higher-paying positions in private practice or corporate healthcare settings, implying that her commitment to community service reflected poor judgment or lack of ambition rather than deliberate choices based on personal values and professional calling. These tensions had escalated over recent months, as Elena began making financial demands that strained Sarah and Michael's carefully managed budget. Elena claimed that her fixed income from Social Security and pension benefits was insufficient to cover her living expenses in Chicago, and she requested regular financial assistance for rent, utilities, and medical expenses that she insisted were beyond her means. The stage was now set for Sarah to discover that her mother-in-law's behavior was not merely difficult family dynamics, but evidence of a conspiracy that would challenge everything she thought she knew about healthcare, family loyalty, and her own capacity to fight institutional corruption. Sarah's growing awareness that something was fundamentally wrong with Elena's behavior began with small observations that individually seemed unremarkable, but collectively formed a pattern that defied logical explanation. The first indication emerged during a routine family dinner at Sarah and Michael's apartment, when Elena mentioned receiving medical care at Meridian Healthcare Network facilities, specifically citing appointments with specialists whose names Sarah recognized from her professional network. The coincidence struck Sarah as unusual because Elena had moved to Chicago from Phoenix specifically to access better healthcare options, yet she had somehow navigated the complex process of establishing care within the same corporate healthcare system where Sarah worked. This navigation typically required extensive paperwork, insurance verification, and waiting periods that challenged even patients with healthcare experience, yet Elena appeared to have achieved seamless integration into multiple specialty services within weeks of her arrival. When Sarah inquired about Elena's experience with Meridian's patient services, her mother-in-law provided detailed knowledge about internal procedures, staff scheduling patterns, and administrative protocols that exceeded what typical patients would encounter during routine care. Elena's familiarity with corporate terminology, billing procedures, and departmental structures suggested exposure to operational information that was not generally available to individuals receiving services as standard patients. Sarah's professional experience had taught her to recognize when patients possessed unusual knowledge about healthcare operations, as this often indicated previous employment in medical settings or ongoing involvement in healthcare administration that might affect their treatment planning. However, Elena had consistently described her background as clerical work in non-medical industries, making her sophisticated understanding of Meridian's operational details increasingly puzzling. The second significant observation occurred when Sarah noticed Elena's financial spending patterns contradicted her claims about experiencing economic hardship due to fixed retirement income. Despite requesting regular financial assistance from Sarah and Michael for basic living expenses, Elena frequently appeared with expensive clothing, jewelry, and personal items that suggested access to discretionary income significantly beyond what she had described as her financial resources. Elena's explanations for these purchases typically involved references to sales, gifts from friends, or items acquired during her previous residence in Phoenix that she was now bringing into regular use. However, the frequency and quality of new acquisitions suggested ongoing purchasing power that was inconsistent with someone struggling to meet basic living expenses on Social Security and pension benefits. Sarah began documenting these inconsistencies in a private journal, not from suspicion but from genuine confusion about how to reconcile Elena's requests for financial assistance with evidence of continued spending on non-essential items. As a healthcare professional accustomed to working with elderly patients on fixed incomes, Sarah understood the typical spending patterns and budget constraints that characterized retirement-age individuals, making Elena's financial behavior increasingly difficult to understand. The documentation process revealed additional patterns that extended beyond simple financial inconsistencies. Elena's schedule included frequent appointments and activities that she described vaguely as errands or meetings with friends, but these commitments often occurred during business hours and involved locations throughout the Chicago metropolitan area that seemed inconsistent with typical social activities for someone claiming limited mobility and transportation challenges. Moreover, Elena's knowledge about local resources, services, and institutions exceeded what Sarah would expect from someone who had recently relocated to Chicago and claimed to be struggling with the transition to a new city. Elena frequently provided detailed recommendations about restaurants, services, and businesses throughout the region, suggesting familiarity that typically required extensive local experience or professional involvement in community services. Sarah's growing awareness of these inconsistencies was heightened by her professional training in patient assessment, which had developed her ability to recognize when individuals' self-reported circumstances did not align with observable evidence. Healthcare professionals learn to identify discrepancies between patient statements and clinical presentations because such inconsistencies often indicated underlying conditions, medication compliance issues, or social factors that affected treatment planning. The skills that made Sarah effective in her therapeutic work, careful observation, pattern recognition, and systematic documentation, now revealed that Elena's presence in their lives involved complexities that extended far beyond typical family relationship challenges. However, Sarah struggled to understand what these patterns might indicate, or whether her growing concerns reflected legitimate observations or unfair suspicion of Elena's behavior. The third major concern emerged when Sarah began noticing Elena's unusual interest in Sarah's professional activities, particularly her patient caseload, treatment protocols, and workplace policies at Riverside Community Health Center. Elena's questions initially appeared to reflect natural curiosity about Sarah's career and genuine interest in understanding her daughter-in-law's professional achievements and challenges. However, Elena's inquiries gradually became more specific and focused on details that seemed beyond typical family interest. Elena asked detailed questions about patient demographics, insurance coverage patterns, treatment duration standards, and administrative procedures that governed Sarah's daily work. These questions often occurred during casual conversations but consistently focused on operational aspects of healthcare delivery that would be relevant primarily to individuals with professional or administrative involvement in similar systems. Sarah found herself providing information about workplace policies, patient care protocols, and institutional procedures without initially recognizing that Elena's questions were unusually systematic and detailed. Only when Sarah began reflecting on their conversations did she realize that Elena was accumulating comprehensive knowledge about Meridian Healthcare Network's operational procedures, patient management systems, and administrative practices through seemingly innocent family discussions. The realization that Elena might be using family relationships to gather professional information created a new level of discomfort for Sarah, who took seriously her ethical obligations regarding patient confidentiality and institutional privacy. While Sarah had not disclosed any specific patient information, she recognized that Elena's questions had elicited details about systemic procedures and organizational practices that might be sensitive from a competitive or regulatory perspective. Sarah's growing unease was compounded by Elena's increasing involvement in discussions about Sarah's career development and professional advancement opportunities. Elena frequently suggested that Sarah should pursue positions with higher compensation, better benefits, or greater prestige, consistently framing these recommendations in terms of family financial security and professional achievement, rather than Sarah's stated commitment to community service. These career discussions often included detailed knowledge about alternative employment opportunities within the healthcare industry, specific salary ranges for different positions, and insights about organizational cultures at various healthcare institutions throughout the Chicago area. Elena's familiarity with these professional details exceeded what would be expected from someone whose healthcare experience was limited to receiving patient services. The fourth concerning pattern involved Elena's interactions with Michael, particularly her apparent efforts to influence his perspective about Sarah's professional choices and their marriage's financial dynamics. Elena frequently engaged Michael in private conversations about household finances, career planning, and long-term family goals, often when Sarah was absent or occupied with other activities. Michael had begun expressing concerns about their financial situation that closely echoed Elena's previous comments, suggesting that she was successfully influencing his thinking about issues that had not previously been sources of tension in their marriage. These concerns typically focused on Sarah's choice to work in community healthcare rather than pursuing higher-paying positions in private practice or corporate settings. The changes in Michael's perspective created new stress in Sarah and Michael's relationship, as they found themselves having disagreements about priorities and decisions that had previously reflected shared values and mutual understanding. Sarah noticed that Michael's concerns often used terminology and arguments that closely paralleled Elena's previous statements, suggesting that her influence on his thinking was becoming increasingly significant. Sarah's professional training had included education about family systems and the ways that external influences could affect marital relationships, particularly when financial stress or career pressures created vulnerability to outside interference. However, recognizing these dynamics in her own marriage proved emotionally challenging and forced Sarah to confront the possibility that Elena's presence was creating deliberate problems rather than simply reflecting normal adjustment difficulties. The fifth area of concern involved Elena's apparent monitoring of Sarah's daily schedule, work commitments, and personal activities. Elena frequently demonstrated knowledge about Sarah's whereabouts, appointment times, and professional obligations that exceeded what Sarah had directly communicated to her or to Michael. This knowledge suggested that Elena was gathering information about Sarah's activities through methods that were not immediately apparent. Elena's comments often included references to Sarah's specific patients, workplace interactions, and professional relationships that Sarah had not discussed with family members. While healthcare professionals often shared general information about their work experiences with family, Elena's knowledge extended to details that Sarah was certain she had not disclosed during family conversations. The realization that Elena might be monitoring her activities created feelings of violation and confusion that Sarah struggled to address directly. Confronting Elena about apparent surveillance would require accusations that might damage family relationships and create additional conflict with Michael, who continued to view his mother's behavior as appropriate family interest rather than inappropriate interference. Sarah's growing awareness of these multiple concerning patterns created internal conflict between her professional instincts, which suggested that Elena's behavior warranted serious investigation, and her personal desire to maintain family harmony and avoid creating additional stress in her marriage. The complexity of the situation was heightened by Sarah's recognition that her concerns might reflect unconscious bias or unrealistic expectations, rather than legitimate grounds for suspicion. However, Sarah's professional experience had taught her that patterns of unusual behavior typically indicated underlying issues that warranted careful attention and systematic investigation. Her training in patient assessment emphasized the importance of documenting observations, seeking additional information, and pursuing appropriate consultation when concerning patterns emerged, even when those patterns were initially difficult to understand or explain. The cumulative effect of these observations was Sarah's growing conviction that Elena's presence in their lives involved deception or manipulation that extended beyond typical family relationship challenges. The sophistication of Elena's knowledge about healthcare operations, her financial inconsistencies, her systematic information gathering, and her apparent influence campaigns suggested coordinated activity with specific objectives, rather than spontaneous behavior driven by personal or emotional factors. Sarah's recognition that she needed to investigate Elena's activities more systematically reflected her commitment to protecting her marriage, her professional integrity, and potentially vulnerable individuals who might be affected by whatever activities Elena was actually conducting. The decision to pursue investigation represented Sarah's transformation from passive observer of concerning behavior to active agent seeking truth and resolution. The motivational significance of Sarah's emerging awareness lay in her willingness to trust her professional instincts and personal observations, despite social pressures to maintain family harmony and avoid confrontation. Her commitment to systematic documentation and careful analysis demonstrated how ordinary individuals could use their professional skills and personal integrity to identify problems that others might overlook or dismiss. Sarah's growing determination to understand Elena's true activities reflected the courage that enables individuals to confront uncomfortable truths and pursue necessary action, even when those actions might create personal risk or social conflict. Her journey from confusion to clarity illustrated how careful observation, systematic thinking, and moral conviction could guide ordinary people toward extraordinary discoveries that would ultimately serve the broader community. The stage was now set for Sarah's decision to hire a private investigator, a choice that would transform her from someone experiencing family difficulties into someone capable of exposing institutional corruption and protecting vulnerable populations from systematic exploitation. The specific incident that transformed Sarah's growing concerns into urgent need for action occurred on a Thursday evening in late September when she discovered Elena in her home office, sitting at Sarah's personal computer with patient files from Riverside Community Health Center spread across the desk. The scene violated multiple professional and personal boundaries simultaneously, creating an immediate crisis that demanded decisive response despite the potential consequences for family relationships. Sarah had returned home earlier than usual that evening because her final patient of the day had canceled their appointment, allowing her to leave the clinic at 4:30 rather than her typical 6 o'clock departure time. She had not informed Michael or Elena about the schedule change, planning to use the unexpected free time to complete administrative tasks that she typically handled during weekend hours when the household was quieter. The front door of their apartment opened directly into the living room, and Sarah could see that the door to her small home office was partially open, with light visible from within. This was unusual because Sarah maintained strict boundaries about her workspace, both to protect patient confidentiality and to preserve a quiet environment for completing professional documentation and continuing education requirements that her position demanded. Sarah assumed that Michael might be using her computer for school-related work, a practice they had established during their early marriage, when budget constraints prevented them from purchasing separate devices for their individual professional needs. However, as she approached the office door, she heard Elena's voice speaking in low, urgent tones to someone on the phone, while simultaneously handling papers that Sarah immediately recognized as patient documentation from her workplace. The realization that Elena was accessing confidential patient information while conducting what appeared to be professional conversations created immediate alarm that transcended family relationship concerns and entered the realm of serious ethical and legal violations. Sarah's training had emphasized that patient confidentiality represented one of the most fundamental obligations in healthcare practice, with breaches carrying consequences that could include criminal prosecution, professional license revocation, and civil liability. Sarah paused outside the office door to assess the situation more completely before taking action that might escalate the confrontation, but could also provide crucial information about Elena's activities and motivations. The conversation that she overheard revealed Elena discussing specific patient names, medical conditions, treatment plans, and insurance coverage details, with someone who appeared to be taking notes and asking detailed follow-up questions about clinical and administrative procedures. The content of Elena's phone conversation indicated sophisticated knowledge about Medicare billing procedures, insurance reimbursement patterns, and regulatory compliance requirements that extended far beyond what would be expected from someone with Elena's stated background in clerical work. Elena was using medical terminology correctly, referencing specific billing codes, and discussing treatment authorization processes with expertise that suggested extensive professional experience in healthcare administration or billing operations. More alarming was Elena's discussion of what she termed optimization opportunities related to patient care plans, which appeared to involve extending treatment durations, increasing session frequencies, and adding supplementary services that would maximize insurance reimbursements regardless of medical necessity. Elena was essentially describing systematic healthcare fraud designed to generate revenue through medically unnecessary treatments that would be disguised as legitimate therapeutic interventions. Sarah recognized that she was witnessing evidence of criminal activity that directly affected her patients, her professional integrity, and potentially the financial stability of elderly individuals who trusted Meridian Healthcare Network to provide ethical and necessary medical services. The scope of Elena's knowledge and the systematic nature of her discussions suggested involvement in organized healthcare fraud, rather than isolated instances of billing irregularities. The conversation continued with Elena providing detailed information about specific patients, financial resources, family support systems, and cognitive functioning that would be relevant to determining their vulnerability to exploitation through unnecessary medical services. Elena appeared to be identifying patients who possessed adequate insurance coverage and limited family oversight, making them ideal targets for fraudulent billing schemes that might continue for extended periods without detection. Sarah realized that Elena's previous questions about her work had been designed to gather intelligence about patient populations, administrative procedures, and oversight mechanisms that would enable systematic exploitation of vulnerable elderly individuals. Elena's apparent financial difficulties and requests for family financial assistance had been fabrications designed to establish credibility, while she conducted sophisticated information gathering for criminal purposes. The phone conversation revealed that Elena was working with other individuals who appeared to be implementing similar information gathering activities at multiple healthcare facilities throughout the Chicago metropolitan area. The scope of the operation suggested organized criminal activity involving coordination among multiple participants, with specific roles in identifying, targeting, and exploiting vulnerable patient populations across the regional healthcare system. Elena's discussion included references to recruitment activities that appeared to involve identifying healthcare employees who might be willing to provide insider information or direct assistance with fraudulent billing schemes. Elena mentioned several names that Sarah recognized as colleagues from Meridian Healthcare Network, suggesting that the criminal operation had successfully compromised multiple employees within the organization. The realization that Elena had likely attempted to recruit Sarah herself through their family relationship created additional alarm about the sophisticated nature of the criminal organization and its willingness to exploit personal relationships to achieve its objectives. Elena's presence in their lives was not coincidental family relocation, but deliberate positioning to access insider information about Meridian's operations and patient populations. Sarah understood that her accidental discovery of Elena's activities created both opportunity and obligation to protect vulnerable patients from systematic exploitation, while also exposing criminal activity that could affect thousands of elderly individuals throughout the region. However, the evidence that she was witnessing might not be sufficient to convince law enforcement agencies or regulatory authorities without additional documentation and investigation. The complexity of healthcare fraud investigations typically required extensive documentation, expert analysis of billing patterns, and coordination among multiple regulatory agencies with jurisdiction over different aspects of healthcare operations. Individual allegations of wrongdoing, particularly those involving family relationship conflicts, might be dismissed without corroborating evidence that demonstrated systematic patterns of criminal activity. Sarah also recognized that her accidental discovery placed her in personal danger if Elena and her criminal associates perceived her as a threat to their operations. The sophistication of their information gathering and the scope of their activities suggested resources and connections that could be used to intimidate or retaliate against individuals who threatened their financial interests. The phone conversation concluded with Elena scheduling follow-up meetings and agreeing to provide additional patient information and administrative details that would support continued expansion of the fraudulent billing operation. Elena's casual tone and systematic approach indicated that she viewed her criminal activities as routine business operations rather than serious violations of law and professional ethics. As Elena ended her phone call and began organizing the patient files that she had been reviewing, Sarah retreated quietly to the living room to avoid immediate confrontation while considering her response options. The evidence that she had witnessed created multiple competing obligations: protecting patient confidentiality, preserving evidence of criminal activity, ensuring her personal safety, and managing the impact on her marriage and family relationships. Sarah's professional training had not prepared her for situations where family members were engaged in criminal activity that directly affected her patients and professional responsibilities. The ethical guidelines that governed her practice emphasized patient advocacy and protection of vulnerable populations, but those guidelines assumed that threats to patient welfare would come from external sources rather than from within her personal family relationships. The immediate challenge was determining how to document Elena's activities and gather additional evidence without alerting Elena to her discovery or compromising her personal safety. Elena's criminal associates appeared to have resources and expertise that could make them dangerous to individuals who threatened their operations, particularly if those individuals possessed evidence that could support law enforcement investigations. Sarah recognized that confronting Elena directly would likely result in Elena discontinuing her activities at Sarah's apartment while potentially relocating her operations to locations where Sarah could not monitor them. Such a confrontation might also prompt Elena's associates to target Sarah as a threat to their criminal enterprise, creating personal danger without necessarily protecting the vulnerable patients who were being exploited. The alternative approach involved documenting Elena's activities systematically while maintaining the appearance of normal family relationships until sufficient evidence could be gathered to support effective law enforcement intervention. This approach would require Sarah to tolerate continued criminal activity in her home while working to develop evidence that could ultimately protect larger numbers of vulnerable patients. Sarah's decision-making process reflected the transformation from someone experiencing family relationship difficulties to someone confronting organized criminal activity that threatened vulnerable populations. The scope and sophistication of Elena's criminal operation exceeded anything that Sarah could address through individual action, requiring coordination with law enforcement agencies and regulatory authorities with jurisdiction over healthcare fraud. However, Sarah understood that her unique position as both a healthcare professional and an inadvertent witness to Elena's activities provided opportunities to gather evidence and document criminal behavior that would not be available to external investigators. Her professional knowledge enabled her to understand the significance of Elena's activities and their impact on patient welfare in ways that law enforcement professionals might not immediately recognize. The motivational significance of Sarah's discovery lay in her recognition that accidental access to information about systematic wrongdoing created moral obligations that transcended personal comfort and family harmony. Her professional commitment to patient advocacy and protection of vulnerable populations demanded action despite the personal risks and relationship consequences that such action might create. Sarah's transformation from confused family member to determined advocate illustrated how ordinary individuals could find themselves in positions where their professional knowledge, ethical commitments, and personal circumstances combined to create opportunities for protecting others from systematic exploitation. Her willingness to confront uncomfortable truths and pursue necessary action despite personal cost demonstrated the courage that enables positive social change. The catalyst moment represented Sarah's evolution from passive observer of concerning behavior to active agent committed to protecting vulnerable populations from criminal exploitation. Her recognition that Elena's activities constituted systematic healthcare fraud affecting elderly patients throughout the region transformed her personal family concerns into a mission to expose institutional corruption and hold criminal organizations accountable for their exploitation of vulnerable populations. The stage was now set for Sarah's decision to hire a private investigator, a choice that would provide the systematic documentation and professional expertise necessary to expose the full scope of Elena's criminal operation while protecting Sarah's safety and preserving the evidence needed for effective law enforcement intervention. Sarah spent the sleepless hours following her discovery, analyzing the full implications of what she had witnessed, and the devastating range of obstacles that stood between her current position and any meaningful intervention in Elena's criminal operation. The scope of the challenge extended far beyond simple evidence gathering, encompassing legal complexities, institutional power structures, personal safety concerns, and professional consequences that could destroy both her career and her marriage, while potentially failing to protect the vulnerable patients who were being systematically exploited. The first and most immediate challenge involved the legal complexities surrounding her accidental discovery of Elena's activities. Sarah possessed no formal training in criminal investigation procedures, evidence preservation, or legal documentation standards that would be required to support successful prosecution of healthcare fraud. Her inadvertent witnessing of Elena's phone conversation might not constitute admissible evidence in criminal proceedings, particularly given the circumstances under which she had obtained the information and her lack of legal authority to conduct surveillance activities. Healthcare fraud investigations typically required coordination among multiple federal and state agencies, including the Federal Bureau of Investigation, the Department of Health and Human Services Office of Inspector General, state medical licensing boards, and local law enforcement agencies with jurisdiction over financial crimes. Each agency maintained specific procedures for receiving and evaluating allegations of criminal activity, and individuals without legal training often struggled to navigate these bureaucratic requirements effectively. The complexity of proving systematic healthcare fraud required extensive documentation of billing patterns, patient treatment records, insurance claims processing, and financial transactions that individual witnesses could not access without legal authority. Criminal organizations engaged in healthcare fraud typically employed sophisticated methods to conceal their activities through legitimate appearing documentation, making detection and prosecution extremely challenging even for experienced law enforcement professionals. Sarah recognized that her allegations against Elena would need to overcome significant credibility challenges, particularly given the family relationship that might appear to provide motivation for false accusations. Law enforcement agencies and regulatory authorities routinely encountered allegations arising from personal disputes, requiring substantial corroborating evidence before initiating formal investigations that consumed significant public resources. The second major obstacle involved the institutional power structures that protected established healthcare organizations from external scrutiny and regulatory oversight. Meridian Healthcare Network possessed substantial financial resources, legal representation, and political connections that could be mobilized to defend against allegations of systematic wrongdoing within their facilities and operations. Corporate healthcare organizations typically maintained comprehensive legal departments specifically designed to address regulatory challenges, fraud allegations, and criminal investigations that might threaten their financial interests or public reputation. These legal resources included relationships with law enforcement agencies, regulatory officials, and political leaders that could influence the scope and direction of investigations into corporate wrongdoing. Meridian's corporate structure created additional complexity for investigations because individual facilities operated under centralized administrative control while maintaining separate legal entities that could limit liability exposure for systematic problems. Elena's criminal activities might be characterized as isolated individual wrongdoing rather than institutional corruption, protecting Meridian from broader legal consequences while sacrificing lower-level employees who had been compromised by criminal organizations. The company's charitable mission and community service reputation provided additional protection against allegations of systematic wrongdoing, as regulatory agencies and public officials might be reluctant to pursue investigations that could damage organizations serving vulnerable populations. Meridian's marketing materials emphasize their commitment to serving underserved communities, creating public relations advantages that could complicate efforts to expose institutional problems. Sarah understood that challenging Meridian's operations would require confronting not only the criminal organization that had infiltrated their facilities, but also the corporate legal and public relations apparatus, designed to protect the company's financial interests and public reputation. Individual employees who raised concerns about institutional problems often faced retaliation through termination, professional sabotage, and legal intimidation that could destroy their careers and financial security. The third significant challenge involved Sarah's personal safety and the potential for retaliation by Elena's criminal associates. The sophistication of Elena's operation and her casual references to multiple healthcare facilities suggested involvement in organized criminal activity with substantial financial stakes and resources that could be used to intimidate or harm individuals who threaten their operations. Criminal organizations engaged in healthcare fraud typically generated millions of dollars in illegal revenue annually, providing sufficient resources to employ professional investigators, legal representation, and enforcement personnel who could monitor and respond to threats to their operations. Elena's associates appeared to have successfully infiltrated multiple healthcare facilities and compromised numerous employees, indicating organizational capabilities that extended far beyond individual criminal activity. Sarah's unique position as both a healthcare professional and an inadvertent witness to Elena's activities made her particularly valuable as a source of information about the criminal organization's methods and targets. However, this same position made her a significant threat to their continued operations if she chose to cooperate with law enforcement agencies or regulatory authorities. The criminal organization's apparent recruitment activities among healthcare employees suggested familiarity with intimidation tactics and retaliation methods that could be employed against individuals who refused to cooperate or who threatened to expose their operations. Elena's placement within Sarah's family provided the organization with detailed knowledge about Sarah's daily routine, professional activities, and personal relationships that could be exploited for surveillance or intimidation purposes. Sarah recognized that protecting herself from potential retaliation would require careful planning and coordination with law enforcement agencies that might not immediately understand the scope of the threat or the resources available to the criminal organization. Individual victims of organized crime often found themselves inadequately protected by law enforcement agencies that lacked resources or expertise to address sophisticated criminal operations. The fourth major obstacle involved the potential consequences for Sarah's marriage and family relationships. Elena's criminal activities had been conducted with Michael's knowledge of her presence in their home and her access to Sarah's professional materials, creating potential legal liability for Michael and challenging questions about his awareness of or involvement in his mother's criminal activities. Michael's financial relationship with Elena, including their shared household expenses and his acceptance of Elena's presence in their home, could be characterized as providing material support for criminal activities, even if Michael possessed no knowledge of Elena's true activities. Law enforcement investigations often examined all individuals with financial or logistical connections to criminal operations, requiring extensive legal representation and potentially resulting in criminal charges against family members who had unknowingly facilitated criminal activities. The disclosure of Elena's criminal activities would likely destroy any possibility of continued family relationships, while creating lasting suspicion about Michael's potential involvement in or knowledge of his mother's activities. Sarah's marriage would be subjected to intense scrutiny by law enforcement agencies, regulatory authorities, and potentially media organizations covering the criminal investigation and prosecution. Michael's career as an educator could be jeopardized by association with healthcare fraud allegations, as school districts typically conducted background investigations of employees and their family members to ensure appropriate standards for individuals working with vulnerable populations. The publicity surrounding criminal investigations often created professional consequences that extended beyond the individuals directly involved in criminal activities. Sarah understood that pursuing investigation of Elena's activities might require choosing between protecting vulnerable patients from systematic exploitation and preserving her marriage and family relationships. The moral complexity of this choice reflected the sophisticated nature of Elena's criminal operation and her deliberate exploitation of family relationships to achieve her criminal objectives. The fifth significant challenge involved the potential consequences for Sarah's professional career and financial security. Healthcare professionals who reported concerns about institutional wrongdoing often faced retaliation through employment termination, professional license challenges, and industry blacklisting that could prevent future employment in their chosen field. Meridian Healthcare Network possessed substantial influence within the regional healthcare industry, maintaining relationships with other healthcare organizations, professional licensing boards, and educational institutions that could be leveraged to damage the career prospects of employees who challenged company operations. Corporate retaliation against whistleblowers often involved coordinated efforts to characterize concerned employees as disgruntled, unreliable, or professionally incompetent. The financial consequences of challenging institutional wrongdoing could be devastating for individuals like Sarah and Michael, who depended on steady employment income to maintain their basic living expenses and educational loan obligations. Healthcare professionals typically required several years to establish alternative career paths if they were forced to leave their original field, creating periods of financial hardship that many families could not sustain. Sarah's specialized training in geriatric physical therapy represented significant educational investment and professional development that could be lost if she were forced to leave the healthcare field. The time and financial resources required to develop alternative professional qualifications would be substantial, particularly while managing the stress and uncertainty of criminal investigations and potential legal proceedings. The professional licensing requirements for healthcare providers created additional vulnerability to retaliation through complaints to regulatory boards alleging professional misconduct, incompetence, or ethical violations. Even unfounded complaints could require expensive legal representation and could damage professional reputation while investigations were conducted. Despite these daunting obstacles, Sarah's professional training and personal values compelled her to recognize that inaction would constitute complicity in the systematic exploitation of vulnerable elderly patients who trusted healthcare institutions to provide ethical and necessary medical services. Her accidental discovery of Elena's criminal activities created moral obligations that transcended personal comfort and professional security. The motivational significance of Sarah's situation lay in her recognition that meaningful action often required accepting substantial personal risk and sacrifice for the sake of protecting others from systematic harm. Her professional knowledge and ethical commitments provided clarity about what needed to be done, even when the path forward appeared overwhelming and potentially destructive to her personal circumstances. Sarah's analysis of the obstacles she faced demonstrated the importance of systematic planning and strategic thinking when confronting organized wrongdoing and institutional corruption. Her willingness to acknowledge the full scope of the challenges while maintaining commitment to necessary action illustrated the intellectual courage required for effective advocacy and social change. The complexity of her situation reflected broader challenges faced by individuals who discover systematic wrongdoing within their professional or personal environments. The sophisticated nature of institutional corruption and organized crime required responses that extended beyond individual action, demanding coordination with law enforcement agencies, regulatory authorities, and advocacy organizations with expertise in addressing systematic violations of law and professional ethics. Sarah's determination to pursue investigation despite the overwhelming obstacles demonstrated the transformation that occurs when ordinary individuals recognize their capacity to protect vulnerable populations from systematic exploitation. Her commitment to action reflected understanding that individual courage and professional integrity could create opportunities for positive change even when institutional power structures appeared insurmountable. The foundation was now established for Sarah's decision to hire a private investigator, a choice that would provide the professional expertise and systematic approach necessary to document Elena's criminal activities, while protecting Sarah's safety and preserving evidence for effective law enforcement intervention. The following morning, Sarah began the systematic investigation that would transform her from concerned family member into sophisticated intelligence gatherer, utilizing her professional knowledge and institutional access to develop comprehensive understanding of Elena's criminal operation and its impact on vulnerable patient populations throughout the Chicago healthcare system. This investigation required careful balance between maintaining normal routines and conducting covert research activities that could expose the full scope of the fraudulent billing scheme without alerting Elena or her criminal associates to Sarah's awareness of their activities. Sarah's first objective involved documenting the specific patients whose information Elena had accessed during the phone conversation she had witnessed. Her memory of Elena's discussion included approximately 12 patient names, along with references to medical conditions, insurance coverage details, and treatment authorization information that Elena should not have possessed without legitimate medical necessity for such knowledge. The challenge of verifying Elena's access to specific patient information required Sarah to review medical records and billing documentation through legitimate professional channels, while maintaining strict adherence to patient confidentiality requirements and institutional protocols governing access to protected health information. Sarah's position as a licensed physical therapist provided authorized access to patient records for individuals under her direct care. But accessing information about patients treated by other healthcare providers required documentation of clinical necessity that Sarah could not legitimately establish. Sarah developed a systematic approach to information gathering that utilized her legitimate professional activities while expanding her understanding of billing patterns and administrative procedures that might reveal evidence of systematic fraud. During routine patient care activities, she began paying closer attention to insurance authorization processes, treatment duration patterns, and billing code selections that might indicate unnecessary service provision or fraudulent claims submission. Her investigation revealed concerning patterns in treatment authorization and billing practices that extended beyond Elena's specific criminal activities. Multiple patients were receiving physical therapy services for extended periods that exceeded typical recovery timelines for their documented medical conditions. Treatment plans frequently included supplementary services and specialized equipment that appeared unnecessary given patients' functional status and therapeutic goals. The billing documentation for these extended treatment episodes included authorization codes and insurance approval references that Sarah recognized from Elena's phone conversation, suggesting systematic coordination between Elena's criminal organization and legitimate healthcare providers, who might be unknowingly facilitating fraudulent billing practices or deliberately participating in the criminal scheme. Sarah's analysis of billing patterns revealed sophisticated understanding of Medicare and Medicaid reimbursement structures that enabled the criminal organization to maximize revenue while minimizing detection risk through careful selection of billing codes and service combinations that appeared medically appropriate to automated review systems employed by insurance companies and government agencies. The systematic nature of the billing irregularities indicated that Elena's criminal organization possessed detailed knowledge of regulatory oversight mechanisms and had developed strategies to avoid triggering automated fraud detection systems that monitored unusual billing patterns or service utilization rates. This level of sophistication suggested involvement of individuals with extensive healthcare administration experience and possible insider knowledge of regulatory enforcement procedures. Sarah's investigation expanded to include research into Elena's background and previous employment history, utilizing public record searches and professional licensing databases to verify Elena's stated qualifications and work experience. This research revealed significant discrepancies between Elena's self-reported background and documented employment records that indicated systematic deception about her professional qualifications and previous activities. Public record searches revealed that Elena had previously been employed by healthcare organizations in Phoenix, Arizona, but in positions involving billing administration and insurance processing, rather than the clerical work she had described to Sarah and Michael. Elena's employment history included positions with access to patient billing information, insurance authorization systems, and administrative databases that would have provided training and experience directly applicable to healthcare fraud operations. Further investigation revealed that Elena's departure from her previous employment in Phoenix had coincided with a federal investigation into Medicare fraud at the healthcare organization where she had worked. While Elena had not been individually charged in connection with that investigation, several of her former colleagues had been prosecuted for their participation in fraudulent billing schemes that generated millions of dollars in false claims over multiple years. The pattern of Elena's employment history suggested systematic involvement in healthcare fraud operations across multiple geographic locations, indicating that her current activities in Chicago represented continuation of criminal behavior rather than isolated wrongdoing. Elena's relocation to Chicago and her subsequent placement within Sarah's family appeared to be strategic positioning to access new healthcare facilities and patient populations for continued exploitation. Sarah's research into Elena's financial background revealed additional evidence of systematic deception about her economic circumstances. Property records, vehicle registrations, and financial account information accessible through public databases indicated assets and income sources significantly beyond what Elena had represented to Sarah and Michael during her requests for financial assistance. Elena maintained property ownership in Arizona while also possessing financial accounts and investment holdings that generated substantial income beyond Social Security and pension benefits. The disparity between Elena's actual financial resources and her claims of economic hardship indicated deliberate manipulation designed to establish credibility for her cover story, while maintaining access to legitimate income sources that might attract regulatory attention if disclosed. The sophisticated nature of Elena's financial arrangements suggested coordination with professional advisors who specialized in concealing assets and income from regulatory oversight. The use of multiple financial institutions, property holdings in different states, and investment vehicles designed to minimize reporting requirements indicated systematic planning to avoid detection by law enforcement agencies investigating healthcare fraud operations. Sarah's investigation revealed that Elena's criminal organization operated through a network of healthcare facilities, billing companies, and administrative service providers that created multiple layers of separation between the ultimate beneficiaries of fraudulent billing and the healthcare providers who submitted false claims to insurance companies and government programs. The organizational structure enabled the criminal enterprise to recruit healthcare employees through legitimate appearing employment opportunities with billing companies and administrative service providers that specialized in serving multiple healthcare facilities. These employees often possessed limited awareness of the fraudulent nature of their activities, believing they were performing legitimate administrative functions while actually facilitating systematic billing fraud. Elena's role within this criminal organization appeared to involve recruitment and intelligence-gathering activities that identified vulnerable healthcare facilities and employee targets for infiltration. Her systematic information gathering about Meridian Healthcare Network's operations, patient populations, and administrative procedures provided the criminal organization with detailed knowledge necessary for successful infiltration and exploitation. The scope of Elena's intelligence gathering extended beyond individual patient information to include comprehensive analysis of Meridian's billing procedures, insurance authorization processes, regulatory compliance systems, and management oversight mechanisms. This systematic approach enabled the criminal organization to develop strategies for maximizing fraudulent billing while minimizing detection risk through careful exploitation of procedural gaps and oversight limitations. Sarah's investigation revealed that Elena's criminal associates had successfully placed individuals within multiple departments at Meridian Healthcare Network, including billing administration, patient registration, and clinical documentation. These insider positions provided the criminal organization with real-time access to patient information, billing systems, and administrative procedures that enabled sophisticated fraud operations while maintaining legitimate appearances. The criminal organization's infiltration of Meridian's operations created systematic vulnerabilities that affected all patients receiving services at compromised facilities. Patient treatment plans were being modified to maximize billing opportunities rather than optimize therapeutic outcomes, creating potential for medical harm while generating fraudulent revenue for the criminal enterprise. Sarah discovered that Elena's criminal organization maintained detailed profiles of healthcare employees who might be vulnerable to recruitment through financial pressure, professional dissatisfaction, or personal circumstances that created motivation for cooperation with criminal activities. These profiles included information about employee financial obligations, family circumstances, career aspirations, and personal relationships that could be exploited for recruitment or intimidation purposes. The systematic nature of the criminal organization's employee recruitment activities indicated sophisticated understanding of workplace dynamics and individual psychology that enabled successful identification and manipulation of potential collaborators. Elena's placement within Sarah's family represented application of these recruitment strategies through exploitation of personal relationships rather than direct workplace pressure. Sarah's analysis of the evidence she had gathered revealed that Elena's criminal operation affected hundreds of elderly patients throughout the Chicago metropolitan area, generating millions of dollars in fraudulent billing, while potentially compromising the quality of medical care received by vulnerable populations. The systematic nature of the fraud required immediate intervention by law enforcement agencies with jurisdiction over healthcare crimes and regulatory authorities responsible for protecting patient welfare. However, Sarah's investigation also revealed that successful prosecution of the criminal organization would require extensive coordination among multiple agencies, sophisticated financial analysis of complex billing patterns, and testimony from insider witnesses who possess detailed knowledge of the criminal enterprise's operations and organizational structure. The complexity of building a successful criminal case against Elena's organization exceeded the capabilities of individual witnesses or single law enforcement agencies, requiring coordinated investigation by federal authorities with expertise in healthcare fraud prosecution and resources necessary for comprehensive financial analysis and surveillance operations. Sarah's systematic investigation had transformed her understanding of Elena's activities from isolated criminal behavior to comprehensive criminal enterprise, with sophisticated organizational structure and extensive regional impact. The scope of the criminal operation demanded professional investigation capabilities that exceeded what Sarah could provide through individual research and observation. The motivational significance of Sarah's intelligence-gathering activities lay in her demonstration of how professional knowledge and systematic thinking could be applied to complex criminal investigation challenges. Her willingness to utilize legitimate professional activities to gather evidence of systematic wrongdoing illustrated how ordinary individuals could contribute meaningfully to exposing institutional corruption when guided by ethical commitment and strategic planning. Sarah's transformation from confused family member to sophisticated intelligence analyst demonstrated the potential for personal growth and capability development when individuals committed themselves to protecting vulnerable populations from systematic exploitation. Her systematic approach to evidence gathering reflected the intellectual discipline and moral courage required for effective advocacy against organized criminal activity. The foundation was now established for Sarah's decision to engage professional investigative assistance through hiring a private detective who possessed the expertise, resources, and legal authority necessary to document Elena's criminal activities while protecting Sarah's safety and preserving evidence for successful law enforcement intervention. Sarah's systematic investigation had provided comprehensive understanding of Elena's criminal operation, but the complexity and scope of the healthcare fraud demanded professional expertise that exceeded her capabilities as an individual witness. The decision to seek assistance from a private investigator represented Sarah's recognition that effective response to organized criminal activity required specialized knowledge, legal authority, and investigative resources that were not available through personal research and observation activities. The selection of an appropriate private investigator required careful consideration of multiple factors, including expertise in healthcare fraud investigations, familiarity with federal and state regulatory frameworks governing medical billing practices, and professional credentials that would support credible testimony in potential criminal proceedings. Sarah's research into private investigation services revealed significant variation in qualifications, specializations, and fee structures that demanded thorough evaluation before making a commitment that would consume substantial financial resources. Sarah identified David Chen as a candidate who possessed the specific qualifications necessary for investigating healthcare fraud operations. Chen maintained a private investigation practice, specializing in corporate fraud, regulatory compliance, and financial crimes, with particular expertise in healthcare industry investigations. His professional background included 15 years of experience with the Federal Bureau of Investigation's Healthcare Fraud Unit, where he had participated in prosecutions that resulted in hundreds of millions of dollars in recovered fraudulent payments and criminal convictions for organized healthcare fraud operations. Chen's transition from federal law enforcement to private investigation had been motivated by his recognition that healthcare fraud investigations often required sustained attention and resources that exceeded what was available through government agencies managing multiple concurrent cases with limited staffing and budget constraints. Private investigation services could provide focused attention to individual cases while maintaining the flexibility necessary for adapting investigative strategies based on emerging evidence and changing circumstances. The initial consultation between Sarah and Chen occurred at his office in downtown Chicago, where Sarah presented a comprehensive summary of her observations, documentation, and analysis of Elena's criminal activities. Chen's response to Sarah's evidence demonstrated immediate recognition of the sophisticated nature of the criminal operation and its potential impact on vulnerable patient populations throughout the regional healthcare system. Chen's professional assessment of Sarah's evidence confirmed her analysis that Elena's activities represented systematic healthcare fraud rather than isolated billing irregularities. The organizational structure, financial arrangements, and recruitment strategies that Sarah had documented indicated criminal enterprise with substantial resources and sophisticated understanding of regulatory oversight mechanisms designed to detect and prevent healthcare fraud. Chen explained that healthcare fraud investigations typically required coordination among multiple specialized professionals, including forensic accountants who could analyze complex billing patterns, medical experts who could evaluate the clinical necessity of disputed treatments, and legal specialists who understood the regulatory frameworks governing healthcare billing and insurance reimbursement. The multidisciplinary nature of effective healthcare fraud investigation exceeded what individual private investigators could provide without access to specialized consultants and expert witnesses. The financial scope of Elena's criminal operation, as revealed through Sarah's investigation, suggested fraudulent billing in excess of $10 million annually across multiple healthcare facilities and patient populations. Criminal enterprises generating revenue at this scale typically employed sophisticated legal representation, financial advisors, and operational security measures that required corresponding expertise and resources to investigate effectively. Chen's assessment of the evidence confirmed that Sarah's accidental discovery of Elena's activities provided a rare opportunity to document active criminal operations from an insider perspective. Most healthcare fraud investigations relied on analysis of historical billing patterns and financial records that revealed evidence of completed crimes, but provided limited insight into ongoing criminal activities and organizational structures. Sarah's unique position as both a healthcare professional and an inadvertent witness to Elena's criminal activities provided access to real-time information about the criminal organization's methods, targets, and operational procedures that would be extremely valuable for building comprehensive criminal cases against all participants in the fraudulent billing scheme. Chen explained that successful healthcare fraud prosecutions typically required extensive documentation of criminal intent, systematic patterns of fraudulent billing, and evidence of coordination among multiple participants in the criminal enterprise. Individual instances of billing irregularities might be characterized as administrative errors or clinical judgment disputes, but systematic patterns of unnecessary treatment provision and fraudulent documentation supported criminal charges with substantial penalties. The investigative strategy that Chen proposed involved systematic documentation of Elena's activities through surveillance, financial analysis, and coordination with federal law enforcement agencies that possess jurisdiction over healthcare fraud prosecutions. This approach would require several months of intensive investigation while maintaining Sarah's safety and preserving her ability to continue gathering intelligence about the criminal organization's activities. Chen's professional expertise enabled him to recognize that Elena's criminal organization represented a significant component of a broader healthcare fraud problem affecting elderly populations throughout the United States. The systematic exploitation of Medicare and Medicaid programs through unnecessary treatment provision and fraudulent billing had become a multi-billion-dollar criminal industry that required coordinated law enforcement response at federal and state levels. The sophistication of Elena's criminal operation suggested connections to larger criminal networks that specialized in healthcare fraud and possessed resources for recruiting healthcare employees, infiltrating medical facilities, and maintaining operational security against law enforcement detection. Chen's experience with federal healthcare fraud investigations provided understanding of these criminal networks and the strategies necessary for disrupting their operations effectively. Chen's willingness to accept Sarah's case reflected his recognition that her evidence provided exceptional opportunities for exposing systematic healthcare fraud while protecting vulnerable patient populations from continued exploitation. The combination of Sarah's professional knowledge, her access to Elena's activities, and her commitment to patient advocacy created optimal conditions for successful investigation and prosecution of the criminal organization. The professional relationship that developed between Sarah and Chen represented the first meaningful alliance in her transformation from isolated individual confronting overwhelming challenges to member of a team with specialized expertise and resources necessary for effective action against organized criminal activity. Chen's validation of Sarah's analysis and his commitment to professional investigation provided emotional support while establishing credible foundation for law enforcement intervention. Chen's expertise in healthcare fraud investigation enabled him to understand the broader implications of Elena's criminal activities beyond their immediate impact on individual patients and healthcare facilities. The systematic exploitation of vulnerable elderly populations through unnecessary medical treatments represented violation of fundamental ethical principles that governed healthcare practice, while also constituting theft of public resources through fraudulent insurance claims. The criminal organization's recruitment of healthcare employees through manipulation and intimidation created additional harm by compromising the professional integrity of individuals who had dedicated their careers to patient care and service. Chen recognized that effective response to Elena's criminal operation required not only prosecution of criminal leaders but also protection and rehabilitation of healthcare workers who had been victimized by the criminal organization's recruitment strategies. Chen's professional assessment confirmed that Sarah's investigation had identified criminal activities that demanded immediate intervention by federal law enforcement agencies with jurisdiction over healthcare fraud and organized crime. The scope and sophistication of Elena's criminal operation exceeded what could be addressed through individual action or local law enforcement agencies that lacked specialized expertise in healthcare fraud investigation. The investigative plan that Chen developed with Sarah included systematic documentation of Elena's criminal activities, financial analysis of fraudulent billing patterns, and coordination with federal agencies that possessed authority for healthcare fraud prosecution. This comprehensive approach would provide law enforcement agencies with evidence necessary for successful criminal prosecution while protecting Sarah from retaliation by the criminal organization. Chen's professional credentials and law enforcement experience provided credibility that would support Sarah's allegations when presented to federal investigators and regulatory authorities. His involvement in the investigation transformed Sarah's individual concerns into professionally documented criminal case that demanded serious attention from law enforcement agencies and regulatory authorities responsible for protecting vulnerable patient populations. The alliance between Sarah and Chen represented validation that individual moral courage could attract professional support and expertise when guided by genuine commitment to protecting vulnerable populations from systematic exploitation. Chen's recognition of the importance of Sarah's evidence and his commitment to comprehensive investigation demonstrated how professional expertise could amplify individual advocacy efforts while maintaining focus on broader social justice objectives. Chen's understanding of the regulatory frameworks governing healthcare fraud investigation enabled him to develop strategies for preserving evidence, protecting witness safety, and coordinating with appropriate law enforcement agencies while maintaining compliance with legal requirements that govern private investigation activities. His professional expertise provided structure and legitimacy for investigation activities that might otherwise appear as individual surveillance or harassment. The professional relationship between Sarah and Chen established foundation for systematic approach to documenting criminal activities while protecting all participants from retaliation by the criminal organization. Chen's experience with healthcare fraud investigations provided understanding of operational security measures necessary for conducting covert surveillance and evidence gathering without alerting criminal targets to the investigation. Chen's willingness to coordinate with federal law enforcement agencies on Sarah's behalf reflected his understanding that individual private investigation activities must ultimately support broader law enforcement objectives if they were to result in meaningful protection for vulnerable populations and accountability for criminal organizations. His professional relationships with federal investigators provided mechanisms for transitioning from private investigation to official criminal investigation when sufficient evidence had been gathered. The motivational significance of Sarah's alliance with Chen lay in her recognition that individual commitment to justice could attract professional support and expertise when demonstrated through systematic action and genuine dedication to protecting vulnerable populations. Her willingness to invest personal resources in professional investigation services reflected transformation from concerned individual to committed advocate, willing to take substantial personal risks for broader social benefits. Chen's professional validation of Sarah's analysis and his commitment to comprehensive investigation demonstrated how individual moral courage could catalyze broader professional and institutional response to systematic wrongdoing. The alliance between committed individual and experienced professional created opportunities for achieving results that neither could accomplish independently, while maintaining focus on protecting vulnerable populations from continued exploitation. The systematic investigation conducted by Sarah and David Chen had begun to reveal the full scope of Elena's criminal organization, but their research activities had not gone unnoticed by the sophisticated surveillance and security apparatus that protected the multi-million-dollar healthcare fraud operation from external threats. Within 2 weeks of Chen's involvement in the case, Elena's criminal associates had identified the investigation as a significant threat to their operations and had begun implementing countermeasures designed to neutralize the threat while protecting their financial interests and operational security. The first indication that the criminal organization was aware of Sarah's investigation emerged when Elena's behavior patterns shifted dramatically from her previous routine of conducting phone conversations and document review activities in Sarah's home office. Elena suddenly began leaving the apartment during daytime hours when Sarah was at work, claiming she was visiting friends or attending medical appointments that required her absence for extended periods throughout the day. Elena's new schedule eliminated Sarah's opportunities for direct observation of criminal activities, while also suggesting that the criminal organization had developed alternative locations for conducting sensitive operations away from potential surveillance. The sophistication of this operational adjustment indicated that Elena's criminal associates possessed professional security expertise and had implemented systematic monitoring of their own activities to detect potential threats from law enforcement or private investigators. Chen's surveillance activities confirmed that Elena was indeed conducting criminal operations from alternative locations, including a commercial office space in a suburban business park that served as headquarters for a billing company that provided administrative services to multiple healthcare facilities throughout the Chicago metropolitan area. The billing company operated under the legitimate business name Midwest Healthcare Solutions and maintained professional appearances that concealed its role as the operational center for systematic healthcare fraud affecting dozens of medical facilities. The discovery of Midwest Healthcare Solutions revealed the sophisticated organizational structure that enabled Elena's criminal enterprise to operate with apparent legitimacy while conducting systematic fraud on a massive scale. The company employed approximately 30 individuals in positions ranging from billing specialists and insurance coordinators to administrative managers and customer service representatives who interacted with healthcare providers and insurance companies as part of their daily operations. Most employees of Midwest Healthcare Solutions appeared to be legitimate healthcare administration professionals who possessed limited awareness of the fraudulent nature of their work activities. The criminal organization had successfully created operational compartmentalization that enabled systematic fraud while protecting individual employees from criminal liability through careful limitation of their access to information about the broader criminal enterprise. Chen's investigation revealed that Elena occupied a senior management position within Midwest Healthcare Solutions that provided her with oversight responsibility for billing operations affecting multiple healthcare facilities, including Meridian Healthcare Network, where Sarah worked. Elena's role involved coordination between the billing company and healthcare providers to optimize insurance reimbursements through strategies that the company presented as legitimate revenue enhancement services. The systematic nature of the criminal organization's operations exceeded what Sarah and Chen had initially anticipated based on their observations of Elena's individual activities. The billing company maintained contracts with 47 healthcare facilities throughout Illinois, Wisconsin, and Indiana, generating fraudulent insurance claims estimated to exceed $50 million annually through systematic provision of medically unnecessary treatments and services. The criminal organization's ability to operate on such a massive scale without detection by federal regulatory agencies demonstrated sophisticated understanding of healthcare billing systems, insurance company review procedures, and government oversight mechanisms designed to prevent fraud. The organization had successfully identified and exploited systematic weaknesses in regulatory frameworks while maintaining operational security against law enforcement detection. Chen's analysis of the criminal organization revealed that Elena's recruitment activities extended far beyond simple infiltration of individual healthcare facilities. The organization maintained systematic programs for identifying and recruiting healthcare employees who could be compromised through financial pressure, professional advancement opportunities, or intimidation tactics that created compliance with criminal activities. The recruitment strategies employed by Elena's criminal organization reflected sophisticated understanding of workplace dynamics and individual psychology that enabled successful identification of potential collaborators among healthcare professionals. The organization maintained detailed profiles of target employees that included information about personal financial circumstances, professional aspirations, family obligations, and personal relationships that could be exploited for recruitment purposes. Elena's placement within Sarah's family represented application of these recruitment strategies through exploitation of personal relationships rather than direct workplace pressure. The criminal organization had identified Sarah as a potentially valuable asset due to her professional position at Meridian Healthcare Network, and had deployed Elena to establish long-term access to insider information about facility operations and patient populations. The systematic nature of Elena's infiltration of Sarah's family indicated that the criminal organization possessed extensive resources for conducting background investigations, developing cover stories, and maintaining false identities that enabled successful placement of operatives within target environments. Elena's relocation to Chicago and her establishment of relationships with Sarah and Michael represented substantial investment in long-term strategic positioning rather than opportunistic criminal activity. Chen's investigation revealed that the criminal organization employed professional investigators and security personnel who conducted systematic surveillance of law enforcement agencies, regulatory authorities, and private citizens who might pose threats to their operations. The organization maintained sophisticated intelligence gathering capabilities that enabled early detection of potential investigations while providing advance warning of regulatory enforcement activities. The criminal organization's security apparatus included former law enforcement professionals who possessed detailed knowledge of investigation procedures, surveillance techniques, and evidence preservation requirements that enabled development of effective countermeasures against both private investigators and federal agencies. The organization's ability to recruit former law enforcement personnel indicated substantial financial resources and professional networking capabilities that extended beyond typical criminal enterprises. Sarah's investigation activities had triggered systematic surveillance by the criminal organization's security personnel, who had identified both Sarah and Chen as threats, requiring immediate attention and potential neutralization. The organization's response to their investigation demonstrated professional capabilities that posed significant risks to Sarah's personal safety and Chen's ability to continue gathering evidence without detection. The criminal organization's countermeasures included deployment of surveillance teams to monitor Sarah's daily activities, workplace communications, and personal relationships, in efforts to determine the scope of her knowledge about their operations and her potential cooperation with law enforcement agencies. The sophistication of this surveillance exceeded what most individuals would recognize or detect without professional security training. Chen's experience with federal law enforcement enabled him to identify the criminal organization's surveillance activities and implement security protocols designed to protect Sarah while maintaining the integrity of their investigation. However, the professional capabilities of the criminal organization's security apparatus created substantial challenges for continuing investigation activities without alerting criminal targets to the scope of evidence being gathered. The criminal organization's response to Sarah's investigation included systematic efforts to discredit her professionally through anonymous complaints to regulatory authorities, alleging violations of patient confidentiality, professional misconduct, and ethical breaches that could result in license suspension or criminal charges. These complaints were carefully crafted to appear legitimate while creating regulatory investigations that would consume Sarah's time and financial resources while damaging her professional reputation. The sophistication of the criminal organization's professional retaliation strategies demonstrated extensive knowledge of healthcare regulatory frameworks and professional licensing procedures that could be exploited to neutralize threats from healthcare professionals who might possess insider knowledge of fraudulent activities. The organization had successfully employed similar tactics against other healthcare workers who had attempted to report concerns about billing irregularities or patient care violations. Sarah's employer, Meridian Healthcare Network, received anonymous allegations that Sarah was accessing patient records without legitimate clinical necessity and potentially providing confidential patient information to unauthorized individuals for undisclosed purposes. These allegations triggered internal investigation procedures that required Sarah to respond to formal inquiries about her professional activities while defending her actions before supervisors and compliance officials. The criminal organization's ability to generate apparently credible allegations against Sarah demonstrated sophisticated understanding of healthcare compliance procedures and the regulatory environment that governed patient confidentiality requirements. The organization possessed detailed knowledge of Sarah's work activities and patient caseload that enabled development of allegations that appeared plausible to regulatory authorities conducting preliminary investigations. Chen recognized that the criminal organization's professional retaliation against Sarah represented escalation of their defensive strategies and indicated that the investigation was generating significant concern about potential exposure of their operations. The systematic nature of their response suggested that Sarah and Chen had successfully identified critical vulnerabilities in the criminal enterprise that warranted aggressive defensive measures. The criminal organization's escalated response also indicated that their operations generated sufficient revenue to justify substantial investment in professional security services and legal representation necessary for protecting their interests against law enforcement investigation. The financial stakes involved in their fraudulent billing operations exceeded what Chen had initially estimated based on Elena's individual activities. Chen's analysis of the criminal organization's response confirmed that Sarah's accidental discovery of Elena's activities had provided access to criminal enterprise, with connections to broader networks of organized healthcare fraud, affecting multiple states and potentially generating hundreds of millions of dollars in fraudulent insurance claims annually. The scope of the criminal operation demanded immediate coordination with federal law enforcement agencies that possessed jurisdiction over interstate healthcare fraud and organized crime. The professional capabilities demonstrated by the criminal organization's security apparatus indicated that continued investigation by Sarah and Chen alone would likely result in escalated retaliation that could threaten Sarah's safety while potentially compromising evidence necessary for successful criminal prosecution. The sophistication of the criminal enterprise demanded law enforcement response with resources and authority that exceeded what private investigation could provide. The criminal organization's systematic approach to neutralizing threats demonstrated institutional knowledge of law enforcement procedures and regulatory oversight mechanisms that suggested corruption or compromise of individuals within government agencies responsible for healthcare fraud enforcement. Chen's experience with federal investigations enabled him to recognize indicators of potential institutional corruption that required careful handling through appropriate channels within law enforcement hierarchy. The emergence of organized opposition to Sarah's investigation represented validation that her commitment to protecting vulnerable patients had identified criminal activities of sufficient scope and sophistication to warrant aggressive defensive responses by criminal enterprises with substantial financial resources and professional capabilities. The systematic nature of their opposition confirmed that individual moral courage could threaten institutional corruption when supported by professional expertise and systematic investigation. The criminal organization's escalated response also demonstrated that Elena's fraudulent activities represented a component of broader criminal network that possessed resources for protecting their operations through professional security services, legal representation, and potential corruption of regulatory oversight mechanisms. The scope of their defensive capabilities indicated that successful opposition to their activities would require coordination with federal law enforcement agencies and sustained commitment despite personal risks and professional consequences. Sarah's recognition that she was confronting organized criminal enterprise with sophisticated defensive capabilities represented transformation in her understanding of the challenge she had undertaken and the resources necessary for successful protection of vulnerable patient populations from systematic exploitation. The criminal organization's systematic campaign to destroy Sarah's credibility and professional standing escalated dramatically during the third week of October, when anonymous allegations against her professional conduct triggered formal investigations by multiple regulatory agencies simultaneously. These coordinated attacks represented sophisticated character assassination designed to overwhelm Sarah's ability to respond effectively while creating legal and financial pressures that would force her to abandon her investigation of Elena's criminal activities. The Illinois Department of Financial and Professional Regulation received detailed complaints alleging that Sarah had violated patient confidentiality requirements by accessing medical records without legitimate clinical necessity and sharing protected health information with unauthorized individuals for undisclosed purposes. The complaints included specific patient names, dates of alleged unauthorized access, and references to institutional policies that Sarah had allegedly violated during her investigation activities. The sophistication of these allegations demonstrated the criminal organization's detailed knowledge of Sarah's legitimate work activities and their ability to manipulate factual information to create apparently credible accusations of professional misconduct. The complaints were carefully constructed to include sufficient accurate details about Sarah's patient caseload and work schedule to appear authentic, while making allegations that would be difficult to disprove without extensive documentation of her daily activities. The regulatory investigation process required Sarah to respond to formal inquiries about her professional activities, while providing detailed explanations of her patient care decisions and record access patterns during the period when she had been conducting research into Elena's criminal activities. The burden of proof in professional licensing proceedings typically favored regulatory authorities, requiring healthcare professionals to demonstrate compliance with all applicable requirements, rather than requiring investigators to prove violations beyond reasonable doubt. Sarah's preparation of responses to regulatory inquiries consumed substantial time and financial resources, as she consulted with attorneys specializing in healthcare law and professional licensing matters. The legal expenses associated with defending against regulatory allegations exceeded Sarah's monthly income and required her to deplete savings that had been accumulated for emergency expenses and future educational investments. The timing of the regulatory investigations coincided with the busy autumn season at Riverside Community Health Center, when patient loads typically increased due to weather-related injuries and seasonal health complications affecting elderly populations. Sarah's ability to provide optimal patient care was compromised by the stress and time demands associated with responding to regulatory allegations while maintaining her normal professional responsibilities. The criminal organization's attack on Sarah's professional standing extended beyond regulatory agencies to include her employer Meridian Healthcare Network, which received anonymous complaints alleging that Sarah was conducting unauthorized research activities using company resources and potentially exposing the organization to legal liability through violations of patient confidentiality requirements and institutional policies governing employee conduct. Meridian's Human Resources Department initiated formal disciplinary proceedings that required Sarah to attend multiple meetings with supervisors and compliance officials to explain her work activities and defend her professional conduct. The disciplinary process created additional stress and uncertainty about her continued employment, while requiring her to provide detailed information about her investigation activities that could potentially compromise the confidentiality of her work with David Chen. The sophistication of the allegations against Sarah suggested that the criminal organization possessed insider knowledge of Meridian's policies and procedures, as well as detailed information about Sarah's specific work activities and patient interactions. This insider knowledge indicated that Elena's criminal associates had successfully infiltrated Meridian's administrative systems and possessed access to personnel records and patient information that enabled targeted attacks on employees who posed threats to their operations. Sarah's colleagues at Riverside Community Health Center began to distance themselves from her as rumors about the regulatory investigations and disciplinary proceedings created concerns about potential guilt by association. Healthcare professionals typically maintained careful professional boundaries when colleagues faced regulatory scrutiny, understanding that association with individuals under investigation could create additional regulatory attention and professional risks. The social isolation that resulted from her colleagues' caution created additional emotional stress for Sarah while eliminating professional support networks that had previously provided encouragement and assistance during challenging periods. The criminal organization's success in isolating Sarah from professional relationships demonstrated their understanding of workplace dynamics and their ability to exploit social pressures to achieve strategic objectives. The personal attacks escalated when Sarah began receiving threatening phone calls at her home during evening hours, when she and Michael were typically present together. The calls initially consisted of anonymous warnings that she should discontinue her quote, inappropriate activities and focus on her legitimate responsibilities as a healthcare professional and family member. The threatening communications demonstrated detailed knowledge of Sarah's daily schedule, personal relationships, and family circumstances that indicated systematic surveillance by professional investigators employed by the criminal organization. The callers referenced specific details about Sarah's commute to work, her shopping patterns, and her social activities that could only have been obtained through sustained observation of her personal life. The psychological impact of the threatening communications created constant anxiety about personal safety, while forcing Sarah to modify her daily routines and social activities to minimize potential exposure to surveillance or direct confrontation. The stress of living under constant threat affected her sleep patterns, concentration abilities, and overall emotional well-being in ways that compromised both her professional performance and her personal relationships. Michael initially dismissed Sarah's concerns about the threatening communications as paranoia related to stress from the regulatory investigations and workplace conflicts. His skepticism about the seriousness of the threats created tension in their marriage, while leaving Sarah feeling isolated and unsupported during the most challenging period of her professional life. The criminal organization's attacks on Sarah's marriage relationship demonstrated their sophisticated understanding of family dynamics and their willingness to exploit personal relationships to achieve strategic objectives. The systematic nature of their campaign indicated professional expertise in psychological warfare and intimidation tactics that exceeded typical criminal activities. David Chen's professional assessment of the threats against Sarah confirmed that she was facing organized retaliation by criminal enterprises with substantial resources and sophisticated capabilities. Chen's experience with federal law enforcement had exposed him to similar intimidation campaigns employed by organized crime groups to neutralize threats from witnesses and law enforcement personnel. Chen implemented security protocols designed to protect Sarah from direct physical threats, while maintaining the integrity of their ongoing investigation. However, the professional capabilities of the criminal organization's security apparatus created substantial challenges for providing adequate protection without alerting criminal targets to the scope of law enforcement interest in their activities. The criminal organization's campaign against Sarah included systematic efforts to damage her reputation within the broader healthcare community through distribution of false information about her professional conduct and character. Anonymous communications to professional associations, educational institutions, and potential employers alleged that Sarah was unreliable, dishonest, and potentially dangerous to vulnerable patient populations. These character assassination efforts were designed to destroy Sarah's future employment prospects within the healthcare industry while creating lasting damage to her professional reputation that would persist even after successful resolution of the current regulatory investigations. The systematic nature of these attacks demonstrated the criminal organization's commitment to permanent neutralization of threats rather than temporary deterrence of unwanted activities. The financial pressure created by legal expenses, potential loss of employment, and ongoing regulatory proceedings threatened to force Sarah into bankruptcy while eliminating her ability to continue supporting the investigation activities necessary for exposing the criminal organization's operations. The economic warfare tactics employed against Sarah reflected sophisticated understanding of individual vulnerability and the financial pressures that could force compliance with criminal demands. Sarah's family relationships faced additional strain when Elena began making subtle comments about the stress that Sarah's problems at work were creating for Michael, and suggesting that Sarah's professional difficulties reflected poor judgment and irresponsible behavior that threatened the family's financial security and social standing. Elena's manipulation of family dynamics represented continuation of her original recruitment strategy while adapting to the changed circumstances created by Sarah's investigation activities. The criminal organization's ability to maintain Elena's access to Sarah's family while conducting systematic attacks demonstrated their sophisticated operational security and strategic planning capabilities. The psychological warfare conducted against Sarah included systematic efforts to create doubt about her own perceptions and decision-making abilities through gaslighting tactics that questioned her memory, judgment, and emotional stability. These tactics were designed to undermine Sarah's confidence while creating uncertainty about the validity of her concerns regarding Elena's criminal activities. The cumulative effect of the coordinated attacks against Sarah's professional standing, personal relationships, financial security, and psychological well-being represented comprehensive assault designed to force her withdrawal from investigation activities while discrediting any future allegations she might make against the criminal organization. Sarah's response to these systematic attacks demonstrated remarkable resilience and commitment to protecting vulnerable patient populations despite severe personal costs. Her willingness to continue pursuing justice while facing professional retaliation, financial pressure, and personal threats illustrated the transformation from ordinary healthcare professional to committed advocate, willing to sacrifice personal security for broader social benefits. The motivational significance of Sarah's situation lay in her recognition that meaningful challenges to institutional corruption typically provoke sophisticated defensive responses designed to test the commitment and courage of those seeking justice. Her willingness to persist despite overwhelming opposition demonstrated the strength of character necessary for effective advocacy against organized criminal activity. Sarah's experience illustrated how individual moral courage could threaten criminal enterprises with substantial resources, while highlighting the personal costs associated with challenging systematic wrongdoing. Her determination to continue fighting despite escalating opposition provided inspiration for others facing similar challenges in their own professional and personal circumstances. The systematic nature of the attacks against Sarah validated the importance of her investigation, while demonstrating the sophisticated capabilities of criminal organizations engaged in healthcare fraud. The resources deployed against her confirmed that she had successfully identified criminal activities of sufficient scope and financial importance to warrant aggressive defensive measures by organized criminal enterprises. Sarah's persistence in pursuing investigation activities despite escalating personal attacks had begun to attract attention from unexpected sources throughout the Chicago healthcare community. As her commitment to protecting vulnerable patients resonated with professionals who had witnessed similar concerns about systematic billing irregularities, but lacked the evidence or courage to pursue formal complaints. The systematic nature of Sarah's documentation and her willingness to accept personal consequences for challenging institutional corruption created opportunities for building broader coalitions among healthcare professionals who shared her commitment to ethical patient care. Dr. Maria Santos, a geriatrician at Northwestern Memorial Hospital, contacted David Chen after learning about Sarah's investigation through professional networks within the Chicago medical community. Dr. Santos had observed concerning patterns in patient referrals and insurance authorizations that suggested systematic manipulation of treatment plans to maximize billing opportunities rather than optimize therapeutic outcomes, but she had been unable to document sufficient evidence to support formal allegations of healthcare fraud. Dr. Santos's professional experience included 15 years of clinical practice specializing in elderly patient populations, providing her with extensive knowledge of typical treatment patterns and recovery timelines that enabled identification of medically unnecessary services and extended treatment episodes. Her clinical expertise would prove invaluable for evaluating the medical necessity of treatments that Elena's criminal organization was billing to insurance companies and government programs. The alliance between Sarah and Dr. Santos represented expansion of the investigation beyond documentation of administrative irregularities, to include clinical assessment of patient care quality and medical necessity determinations that would support criminal prosecution of healthcare fraud. Dr. Santos's professional credentials and clinical expertise provided credibility that would be essential for convincing law enforcement agencies and regulatory authorities that the criminal organization was systematically harming patients while defrauding insurance programs. Dr. Santos revealed that her own patients had been targeted by billing companies that provided unsolicited recommendations for extended physical therapy, occupational therapy, and specialized medical equipment that appeared unnecessary given their documented medical conditions and functional status. The systematic nature of these recommendations suggested coordinated efforts to identify vulnerable patients with adequate insurance coverage for exploitation through unnecessary service provision. The clinical evidence that Dr. Santos provided, confirmed Sarah's analysis that Elena's criminal organization was systematically compromising patient care quality while generating fraudulent insurance revenue through medically inappropriate treatment plans. The combination of administrative documentation and clinical assessment created comprehensive evidence of systematic healthcare fraud that affected hundreds of elderly patients throughout the Chicago metropolitan area. Robert Kim, a financial analyst specializing in healthcare billing audits, joined the growing coalition after Chen contacted him for assistance with analyzing the complex billing patterns that characterized Elena's criminal organization. Kim's professional expertise in forensic accounting and healthcare reimbursement systems provided specialized knowledge necessary for understanding the financial structures that enabled systematic fraud while maintaining apparent compliance with regulatory requirements. Kim's analysis of billing data obtained through Sarah's investigation revealed sophisticated understanding of Medicare and Medicaid reimbursement structures that enabled the criminal organization to maximize revenue while minimizing detection risk through careful selection of billing codes and service combinations. The financial analysis confirmed that the criminal organization was generating fraudulent revenue estimated to exceed $100 million annually across multiple states and healthcare facilities. The forensic accounting expertise that Kim provided enabled the coalition to develop comprehensive financial documentation that would support federal prosecution of organized healthcare fraud while demonstrating the scope and systematic nature of the criminal enterprise. The financial evidence complemented the clinical and administrative documentation to create overwhelming proof of systematic criminal activity affecting vulnerable patient populations. Jennifer Walsh, an investigative journalist specializing in healthcare policy and corporate accountability, learned about the investigation through professional sources and offered to provide media coverage that would expose the criminal organization's activities while protecting the safety and anonymity of coalition members. Walsh's experience with healthcare fraud reporting provided understanding of the legal and ethical considerations necessary for responsible journalism about ongoing criminal investigations. Walsh's involvement in the coalition provided opportunities for public education about healthcare fraud, while creating pressure for regulatory and law enforcement response to systematic criminal activity. The media coverage would serve multiple strategic objectives, including protection for coalition members through public visibility, education for potential victims about fraudulent billing practices, and accountability pressure for regulatory agencies responsible for healthcare oversight. The journalists' professional network included contacts within federal law enforcement agencies, regulatory authorities, and government officials responsible for healthcare policy oversight. Walsh's relationships with these institutional actors provided additional channels for communicating evidence of systematic healthcare fraud while ensuring that appropriate authorities received comprehensive documentation of criminal activities. Thomas Chen, David's younger brother and an attorney specializing in whistleblower protection and healthcare law, joined the coalition to provide legal expertise necessary for navigating the complex regulatory and legal frameworks that governed healthcare fraud reporting and witness protection. Thomas's legal knowledge complemented David's investigative expertise while providing specialized understanding of federal whistleblower statutes and protection mechanisms. The legal expertise that Thomas provided enabled the coalition to develop comprehensive strategies for reporting criminal activities to appropriate authorities, while maximizing legal protections for coalition members who faced retaliation by the criminal organization. The legal framework also provided structure for coordinating with federal law enforcement agencies in ways that would support successful prosecution while protecting witness safety. Thomas's analysis of federal whistleblower protection statutes revealed that Sarah and other coalition members qualified for significant legal protections and potential financial rewards through successful reporting of healthcare fraud affecting federal programs. The financial incentives provided by federal whistleblower statutes could partially offset the personal costs that coalition members had incurred while investigating the criminal organization. Lisa Rodriguez, a social worker specializing in elder care advocacy, contacted the coalition after learning about their investigation through community organizations serving elderly populations in neighborhoods affected by Elena's criminal activities. Rodriguez's professional experience included direct service to elderly individuals who had been victimized by various forms of financial exploitation and medical fraud affecting vulnerable populations. Rodriguez's involvement in the coalition provided direct connection to patient populations who had been affected by the criminal organization's fraudulent billing practices. Her professional relationships with elderly patients and their families created opportunities for documenting the human impact of healthcare fraud, while identifying additional victims who could provide testimony supporting criminal prosecution. The Eldercare Advocates professional network included connections to community organizations, senior centers, and family service agencies that served populations targeted by Elena's criminal organization. These institutional relationships provided additional channels for identifying victims and documenting the broader community impact of systematic healthcare fraud affecting vulnerable elderly populations. Dr. James Wilson, a psychiatrist specializing in geriatric mental health, joined the coalition after recognizing that some of his elderly patients had been subjected to medically unnecessary treatments that appeared designed to maximize billing opportunities rather than address legitimate therapeutic needs. Dr. Wilson's clinical expertise provided additional professional credibility while expanding the coalition's understanding of the psychological impact of medical fraud on vulnerable patient populations. Dr. Wilson's professional assessment revealed that elderly patients who had been victimized by fraudulent billing schemes often experienced increased anxiety, depression, and social isolation due to confusion about their medical care and financial exploitation by individuals they had trusted to provide legitimate healthcare services. The psychological impact of healthcare fraud represented additional harm beyond the financial costs of unnecessary treatments and fraudulent insurance claims. The psychiatric expertise that Dr. Wilson provided enabled the coalition to document comprehensive evidence of patient harm resulting from the criminal organization's activities. The clinical documentation of psychological impact complemented the physical and financial harm documentation to create overwhelming evidence of systematic victimization of vulnerable populations. Sarah Martinez, a legal aid attorney specializing in healthcare advocacy for low-income elderly populations, joined the coalition through referrals from community organizations serving populations affected by Elena's criminal activities. Martinez's legal expertise in healthcare law and elder advocacy provided specialized knowledge of regulatory frameworks protecting vulnerable populations, while offering direct legal representation for patients who had been victimized by fraudulent billing practices. The legal advocacy expertise that Martinez provided enabled the coalition to offer direct assistance to elderly patients who had been affected by the criminal organization's activities, while building comprehensive case documentation that would support both criminal prosecution and civil recovery actions. The legal representation also provided protection for elderly witnesses who might face intimidation or retaliation for cooperating with law enforcement investigations. Martinez's professional experience with healthcare fraud cases provided understanding of the evidence requirements necessary for successful prosecution, while offering insights into the institutional barriers that often prevented effective law enforcement response to systematic criminal activity affecting vulnerable populations. The growing coalition represented transformation of Sarah's individual investigation into comprehensive advocacy effort with professional expertise spanning clinical care, financial analysis, legal representation, media coverage, and community organizing. The diverse professional backgrounds and complementary expertise of coalition members created capabilities that exceeded what any individual member could achieve independently. The coalition's systematic approach to documenting evidence and coordinating professional expertise demonstrated how individual moral courage could catalyze broader institutional response to systematic wrongdoing when supported by appropriate professional resources and strategic planning. The collaborative effort illustrated the potential for meaningful social change when committed individuals combined their expertise and resources to address complex challenges affecting vulnerable populations. The motivational significance of the coalition's growth lay in validation that Sarah's initial commitment to protecting vulnerable patients had resonated with professionals throughout the healthcare community, who shared her ethical commitment to patient advocacy and institutional accountability. The willingness of established professionals to risk their careers and reputations to support Sarah's investigation demonstrated the power of individual moral leadership to inspire collective action. The professional diversity of the coalition provided comprehensive capabilities for addressing all aspects of the criminal organization's activities, while offering multiple forms of expertise necessary for successful law enforcement intervention. The combination of clinical assessment, financial analysis, legal representation, media coverage, and community advocacy created optimal conditions for exposing systematic healthcare fraud while protecting vulnerable patient populations from continued exploitation. The coalition's systematic documentation of evidence and professional coordination represented evolution from individual witness testimony to comprehensive institutional challenge that demanded serious attention from federal law enforcement agencies and regulatory authorities responsible for healthcare oversight and protection of vulnerable populations. The devastating betrayal that threatened to destroy Sarah's coalition and expose all members to criminal retaliation emerged from within the most trusted circle of the investigation team, when Robert Kim, the forensic accountant whose financial analysis had provided crucial evidence of systematic healthcare fraud, was revealed to be a double agent working for Elena's criminal organization while simultaneously documenting the coalition's activities and reporting their progress to criminal leadership. The discovery of Kim's betrayal occurred when David Chen's surveillance of Elena's operations detected Kim attending a clandestine meeting with known associates of the criminal organization at a suburban restaurant, where they exchanged detailed documentation about the coalition's investigative activities, evidence-gathering methods, and planned coordination with federal law enforcement agencies. Chen's photographic evidence revealed Kim providing comprehensive briefings about coalition members, professional backgrounds, personal vulnerabilities, and strategic planning discussions that had occurred during confidential coalition meetings. The sophisticated nature of Kim's infiltration demonstrated the criminal organization's advanced intelligence capabilities and their systematic approach to neutralizing threats through placement of operatives within opposition groups. Kim's professional credentials as a forensic accountant had been authentic, but his employment history revealed previous connections to healthcare organizations that had been investigated for billing irregularities, suggesting a pattern of involvement in criminal enterprises disguised as legitimate professional consulting services. The betrayal was particularly devastating because Kim had been instrumental in developing the financial analysis that formed the foundation of the coalition's evidence against Elena's criminal organization. His access to confidential financial documentation and investigative methods had enabled him to provide detailed intelligence to criminal leadership about the scope of evidence being gathered and the specific vulnerabilities that law enforcement investigation might exploit. Kim's betrayal compromised the safety of all coalition members by providing the criminal organization with detailed information about their identities, professional positions, personal circumstances, and involvement in investigation activities. The criminal organization now possessed comprehensive intelligence necessary for targeting individual coalition members through professional retaliation, personal intimidation, and systematic harassment designed to force abandonment of investigation activities. The discovery of Kim's double agent status revealed that the criminal organization had successfully anticipated the formation of opposition coalitions and had developed systematic strategies for infiltrating and compromising such groups through placement of professional operatives with appropriate credentials and expertise. The sophistication of their counterintelligence operations exceeded what Sarah and Chen had initially anticipated when assessing the resources available to Elena's criminal enterprise. Sarah's immediate response to learning about Kim's betrayal involved intense personal reflection about the judgment errors that had enabled his infiltration of the coalition, while questioning the reliability of other coalition members who might also be compromised by criminal operatives. The psychological impact of discovering that someone she had trusted with her safety and the protection of vulnerable patients was actually working to undermine their efforts created profound doubts about her ability to assess character and make sound strategic decisions. The betrayal forced Sarah to confront the possibility that her commitment to protecting vulnerable patients might have created additional risks for innocent people who had joined her coalition based on trust in her judgment and leadership. The responsibility she felt for potentially exposing coalition members to criminal retaliation while operating with compromised intelligence created emotional burden that threatened to overwhelm her determination to continue pursuing justice. David Chen's professional assessment of Kim's betrayal emphasized that infiltration by criminal operatives represented standard operational practice for sophisticated criminal organizations facing external threats. Chen's experience with federal law enforcement had exposed him to similar counterintelligence activities employed by organized crime groups to protect their operations while gathering intelligence about law enforcement investigations and potential witnesses. Chen's analysis revealed that Kim's betrayal, while professionally and personally devastating, actually provided valuable intelligence about the criminal organization's capabilities and strategic priorities. The resources devoted to infiltrating the coalition indicated that Sarah's investigation had identified vulnerabilities of sufficient importance to warrant sophisticated defensive measures by criminal leadership. The criminal organization's investment in placing professional operatives within opposition groups demonstrated their recognition that external investigation posed genuine threats to their operations and financial interests. The systematic nature of their counterintelligence activities confirmed that the coalition had successfully developed evidence and investigative capabilities that demanded serious attention from criminal leadership. Dr. Maria Santos's response to Kim's betrayal reflected the professional resilience and ethical commitment that had motivated her initial involvement in the coalition. Rather than withdrawing from investigation activities due to safety concerns, Dr. Santos increased her commitment to documenting clinical evidence of patient harm while implementing additional security measures to protect her involvement from detection by criminal operatives. Dr. Santos's continued participation in the coalition despite confirmed infiltration by criminal operatives demonstrated the strength of professional commitment to patient advocacy and ethical healthcare practice that transcended personal safety concerns. Her willingness to accept increased personal risk, while maintaining focus on protecting vulnerable patient populations, provided moral leadership that strengthened coalition resolve despite the betrayal. The clinical documentation that Dr. Santos continued to gather provided essential evidence of systematic patient harm that would be crucial for criminal prosecution, regardless of the intelligence that Kim had provided to the criminal organization. The medical evidence of unnecessary treatments and compromised patient care represented objective documentation that could not be undermined by counterintelligence activities or professional infiltration. Jennifer Walsh's journalistic assessment of Kim's betrayal recognized that the story of criminal infiltration of a healthcare advocacy coalition represented significant news value that could generate public attention and accountability pressure for regulatory agencies and law enforcement authorities. Walsh's professional experience with investigative reporting provided understanding of how media coverage could transform individual betrayal into broader public education about organized healthcare fraud. Walsh's strategic approach to reporting Kim's betrayal involved careful coordination with law enforcement agencies to ensure that media coverage would support, rather than compromise, ongoing criminal investigation. The journalistic coverage would serve multiple objectives, including public education about criminal infiltration tactics, accountability pressure for regulatory oversight, and protection for remaining coalition members through increased public visibility. The media coverage of Kim's betrayal would also provide opportunities for identifying additional victims of healthcare fraud, while encouraging other healthcare professionals to report concerns about systematic billing irregularities and patient care violations. The public attention could catalyze broader institutional response to healthcare fraud, while demonstrating the sophisticated capabilities of criminal organizations operating within the healthcare system. Thomas Chen's legal analysis of Kim's betrayal revealed that the discovery of criminal infiltration actually strengthened the coalition's legal position by providing additional evidence of organized criminal activity and systematic obstruction of justice. The criminal organization's deployment of professional operatives to infiltrate opposition groups constituted federal crimes that would enhance potential penalties in criminal prosecution while providing additional grounds for civil litigation. The legal implications of Kim's betrayal extended beyond simple infiltration to include potential charges of obstruction of justice, witness intimidation, and conspiracy to defraud federal healthcare programs. The systematic nature of the criminal organization's counterintelligence activities provided evidence of sophisticated criminal enterprise that would support federal prosecution under organized crime statutes with enhanced penalties. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out. And don't forget to subscribe and turn on the notification bell so you don't miss any upload from us.